You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Dr. Ben Keller. Dr. Keller, welcome to the program.
Good to be here.
Good. Now, I know you brought a stack of photos, so we'll get to as many of those as we can. But for people that don't know your dental implant center, who's the typical patient that you see?
So we don't have just one type of patient.
Okay.
They fall into, you could say, two categories.
Okay.
The first type of patient that would come in, they have their teeth. They might be missing some teeth. They could be missing most of their teeth. They could have teeth that are breaking down and stained. They could have a bacterial infection where it's causing teeth to become loose. And all of them are kind of in the mindset of, I don't know what to do, but I know I don't want a denture.
Okay.
And for those people, we give them upper and lower teeth that don't come out. And then for the second type of person that comes in, they're already wearing a denture. And so they're already experiencing, the loose fitting denture. You have to take it out at night. They eat food and they have to take it out, clean it. And it's not a natural thing. It's ancient technology, a denture is. And so for the people that are wearing dentures, they can come in with no teeth and walk out with upper and lower teeth that do not come out, that we have printed actually in the next room.
Is that right?
Yeah, my surgical operatory.
You make the teeth right there?
My surgical operatory is connected to my digital lab. And so it's quite literally, one step, and my digital lab technician is in the surgical op. So there's no, getting information into the digital realm and letting him do what he needs to do to make the best product he can. It's really, we made it really, really convenient for all parties involved.
Now, where you're from, are there a lot of denture wearers?
There are a lot of denture wearers. People are coming to me from North Carolina, South Carolina, and so if you look at the numbers,
like more than 1,000, you think, in the state?
There are about 3 million people that don't have teeth in the Carolinas.
Is that right?
3 million people.
That's big.
Yeah, and in the United States, if you look at it more broadly, the amount of people that don't have teeth would be the same population of Canada.
I ChatGPT'd this.
Yeah.
30 million, ChatGPT said, people are wearing an upper or lower denture.
That number is a little bit expired. That might have been in 2020.
Oh, really?
The number has now grown to 40 million, because I'll tell you why.
Okay.
The baby boomer population is getting older, and they're outliving their teeth. Modern medicine is allowing people to live longer, and they're outliving their teeth. And so really,
so if it's so good though, why aren't they all doing it? Like if there's over 1 million in your state that are wearing a denture, why aren't they all coming in to get new teeth with implants?
Well, I can tell you, half the people that come in to talk to me about their options on what they can do, they don't even know that teeth that are fixed to implants and don't come out, they don't know those are an option.
Okay.
And so I guess I could break this down for reasons A, B, C, and D.
Okay.
Okay. A, age. People think, oh, I'm too old. My bone must be different than the 25-year-old that's getting this procedure.
Well, how old can you be to get this done?
You can be any age. I've treated patients that are in their 90s. That's pretty routine because they're outliving their teeth. They've gotten good use out of their teeth.
Really?
And they're outliving their teeth, and they just need that next set of teeth. You had your baby teeth, you had your adult teeth, and now you need your final set of teeth.
It's like the third set of teeth, dental
the
implants.
The third set of teeth.
What's your oldest patient?
I believe 2 weeks ago, I treated someone that was 88 years old, and they were struggling because they had a bridge that wasn't staying in, a partial that wasn't staying in, and they would actually keep that stuff in their bedside table.
So they couldn't eat.
They couldn't eat. They dressed extremely well. Best dress, voted best dress for sure.
Okay.
One of my best dressing patients, but not wearing the partial denture that she did have, it took away from the looks a little bit, and she did not like that. So we were able to enhance the way that she looked and enhance the food she ate, and she doesn't have to struggle. She used to refer.
So what'd you do?
Well, she went to sleep with her teeth, and she woke up with our teeth.
Okay.
That's what we did. We gave her teeth. So after she healed up, she could eat whatever she wanted to.
Okay. So when a 75-year-old goes to your office and says, "Doc, am I too old?" It's not even close to too old.
No, there's no age limit on this. The bone doesn't realize how old it is. It's going to work, you know. Another category of people that we treat, they have a denture, and so they're kind of out of the dental office. They're using their own denture. They don't know their options. They may have gotten their denture 10 years ago, and they don't. So my whole thing, why I'm here today, I just want people to know that this is an option, because I have so many people that come in that don't realize their options.
Because the denturers don't go to the dentist anymore, I guess. So they don't even know this exists. Is that right?
That's correct.
You brought some photos. What are we looking at?
This gentleman came into me and he was expressing how he had some insecurities about how the public saw him.
Okay.
And those insecurities were he had the stained front teeth, the breaking down back teeth, and he was thinking that people, you know, they thought, your teeth don't look good. You must be uneducated. Your teeth don't look good.
That's what he tells you.
That's what he tells me.
Okay.
And he also tells me that your teeth don't look good. You know, you must have some drug use. And, you know, your teeth don't look good. You must be unhealthy. And none of these things are the fact.
Okay.
He was taking medications. They were causing a problem. And the teeth needed to go. They lost.
So all of those had to go.
They had to go because they lost all the integrity. They were breaking. We gave him teeth in one visit. He went to sleep and he woke up with new teeth, supported by implants, fixed in place. They did,
nice.
Yeah.
When a guy like this looks at the mirror, in the mirror, for the first time, what's that like?
It's a very emotional experience because it's been so many years since he was able to see himself with a full smile that he wasn't judgmental towards himself about. And for me, it's great to be a part of, because when he comes back for the follow-ups, he's a different guy.
Really?
Yeah, he's smiling. He's talking to the front office staff a little bit more energetically, and he's telling us about, you know, where he went out with his wife. And
it's nice.
All right, so this lady came to me. She didn't like how her teeth were not staying in. She had an upper partial and wasn't staying in.
Okay.
And so she wanted something that stayed in. She wanted something more natural, a more natural look, a more natural feeling, and more natural function.
Now it looks like she's missing all of her teeth in the back.
Yeah, she's missing back teeth. It's affecting the way she's eating. You cannot eat without back teeth. The front teeth designed for ripping food, and then you kind of filter that food to the back of your mouth to chew it.
Okay.
And so without the back teeth, you're not able to eat your food effectively.
Okay.
And so what we did for her is we gave her upper and lower teeth that don't come out. And
looks good.
Yeah. And so now she can confidently smile. She can eat the food she enjoys. And, you know, this is the lady I was talking about earlier who dresses very, very well. She's from London, actually, so fashion capital of the world. And, you know, now she has teeth to match.
What do they like more? The way it looks or what they could eat? Or is it a combination of both?
For her, I would say the way that it looks. A lot of my patients, you know, they're going for looks at first, but then they're enjoying the function. They're enjoying the way that the teeth come together when they're chewing their food. And now she can actually eat foods such as raw broccoli or apples.
So they can even, let's say it's a raw carrot. Could they bite that with their front teeth, or they got to be careful? I'm talking about once they're all healed up.
No, they can eat whatever they want to eat. So whatever food you can eat with the teeth that you had when you were 20 years old, you can eat the same foods.
So she comes in for the appearance, and then so she ends up maybe even liking the fact that she could eat good food again, fibrous foods again.
Yeah. She enjoys that. Everyone does. Here's a patient here.
All right.
And this gentleman, he was not smiling at all when he came to me. He did not like the appearance of his teeth. And, you know, this is far from the worst I've seen.
Okay.
So he wanted some options and what he could do so that he could get a better smile and eat more effectively. And that's what he didn't like about his current teeth. And I'm looking at it thinking, okay, this is going to be a very, very straightforward and easy case. So what we did for him.
And by the way, was his option a denture? Like, could he have gotten a denture if he maybe went to a different place?
If he wanted a denture, he could have had a denture, but it's really, it's below the standard of care, in my opinion, to give someone a denture when they could have alternatively had upper and lower teeth that don't come out. Because when I give someone a denture, I feel bad for them, because really the first 3 months you're wearing that denture, it's going to be the worst 3 months of your life. And people are going to tell you, and the reason is that the denture is made before the surgery is even done. So of course it's not going to fit after the surgery, because all of the anatomy is different. And so you're wearing a denture that doesn't actually fit, and I don't recommend a denture for anybody.
Okay. Yeah. So for him, you gave him upper and lower teeth that don't come out.
I gave him upper and lower teeth that don't come out, and that's same day.
Looks good.
It does look good. And if you notice here, you can see how the teeth follow the lower lip line. That's all by design. And so when he comes in for his next visit, even his kids are treating him differently. They were very curious to see what the final product would look like. And when they were looking at him, I could tell that they were impressed with what his new smile looked like, because my goal for all of my patients actually is to give them a smile that looks better than my smile, and we can do that. We can do that predictably, and I have the photos with the patients, and they look better smiling than I do when I'm standing right next to them.
That's very nice.
Yeah.
Correct me if I'm wrong. If the way dental implants are typically done is you go to one doctor's office that does the surgery, then you go to another office that puts the teeth on top and get them maintained elsewhere. Now you do all three parts. Is that why you do it so quickly?
Yeah, so we have the digital lab that's right in the other room, and so we're able to print teeth in real time and deliver those teeth to the patient. Alternatively, if you were to have to ship cases off, UPS shipping to a lab, or
is that how it's normally done?
It's done like that at most dental offices. Most dental offices,
you send everything out.
Yeah, you don't have a lab in your office. It does really enhance the workflow. You would not be able to give the product same day if you had to use shipping to get the product.
Okay.
And so with our office, it's one doctor, one fee, and I've traveled all over the country to be able to do it this way. It is a very new way of doing things, I will say, because the technology just wasn't there 5 years ago. I mean,
are you doing this at the highest level?
The highest level. You cannot do it any faster, because we have the limiting factor is how quickly can the printer print teeth.
Is that right?
Yeah, and that's something that has changed rapidly over the course of 5 years. You can only be deeply sedated for so long. We need to have those teeth ready for you before you wake up.
Now, what if you have bad gums, like gum disease? Aren't your gums too bad to hold the implants? Is that true?
We clean that out. So that, and we can do that by when we remove the teeth. We clean out the infection, we put the implants in, and then we scan them, print new teeth, and put those on top of the implants. Now, you can also get rid of infection by giving drugs that go systemically, but we debride the infection locally. And so we'll do a combination of the two, but it's very thorough. Let me show you this next picture.
All right.
This gentleman came to me, and he had been to a couple dental offices. He didn't want to continue on with his current teeth. He didn't like the way they looked. So he was kind of the type of patient that could have gone either direction. He could have kept his teeth and tried to fix them up, or get new teeth in just one visit. And so people like this, it's tough to chew. They can't eat very well.
Okay.
They can't smile confidently. He wanted teeth he wanted the whitest teeth he could get. As you can see in the after photo.
This is big. Yeah, looks good.
Yeah. And so
that's like a full set of teeth just connected to implants, upper and lower. Okay.
And it was funny because he was telling me that his family members were saying, "Oh, that sounds like a pretty difficult procedure. I don't know if you should go and do that." But his feedback to me was I kind of showed all of them wrong, because after I got those teeth and they saw them and they saw how quickly it was done, the day before he didn't have them, and then the next day he showed up and he did.
Okay.
He was one of these patients that didn't have any swelling or anything like that after the procedure. So he was able to show them off the next day, and he got really good feedback from family members. And then they told him, at first we said, maybe don't do that, but we're glad you did, because
good.
They like the way they look.
Now, as you mentioned, that they're numbed up, so they don't feel anything. They're sedated, most people. What's it like, the recovery afterwards? What's that like? Could they take over-the-counter like remedies to take care of the pain?
I have a regimen of medications that I routinely prescribe people that have this procedure done.
Okay.
Some people opt not to take them.
What do they do?
They leave them in their cabinet at home, and they don't take the medication because they don't feel like they need it. Their pain level is, low to none, and they don't need to take the medication.
If they do take over-the-counter remedies, what could they take for it?
Tylenol, ibuprofen.
Okay.
Those are the first line drugs over the counter.
And how soon can they eat after it's all done?
Well, depending on how they're feeling, they can eat the same day.
Okay.
Yeah. So Christina came to me. She was 20 years, no teeth, didn't wear a denture.
Wow.
Didn't have teeth. And she was experiencing just hopelessness. She didn't think anyone could fix this problem. And she had actually been to a couple people where she asked, hey, can you help me? And they told her, you don't have enough bone, I'm sorry.
Yeah, but isn't it true though? I mean, if you've been wearing a denture, let's say 10 years, you can't do this, you don't have enough bone.
So I've heard that. Half my patients that come in, nearly tell me that someone told them they didn't have enough bone for the procedure. I haven't found that to be true. It's relatively straightforward to place implants when you have a little bit of training that will, teach you how to do so and have predictable success. I would never take a case on where I have, any type of uncertainty that this case isn't going to be predictable and successful.
Okay, so with her, she's wearing a denture for 20 years. She comes to you.
She comes to me, and we tell her, yeah, we can help you. And she's, of course, a little bit skeptical because of other things she's heard at other offices. And so she went to sleep, and she woke up with teeth. And it's a very it was very interesting because she actually got married 1 month later.
Wow.
Yeah. She's with her significant other, and for years her dating life was, she had some insecurities because she would want to cover her smile, and the person that she was actually with when I met her told her, you don't have to cover your smile. I'm going to love you the same with teeth as I do without teeth. But even though that he told her that, she still felt like she had to cover it because she wasn't happy with the way that she was smiling. And we were able to give her a smile that she was happy about. And so now she's not covering it. Her husband's happy. She's happy. So Randy, put those pictures side by side.
Okay.
Now I'd like you to tell me, does it look like the same person?
She looks different.
She looks a little bit different. Does she look younger?
A lot younger.
Okay.
It almost looks like it could be the daughter of the before photo.
Yeah. Does she look more sophisticated?
Yes.
Does she look more confident?
Yeah.
Does she look more approachable?
That's for sure.
Does she look like someone you'd walk up to and want to start a conversation with?
Probably. Yes.
Yeah. So
that's what teeth do.
That's what teeth do.
Help me understand. I guess there's a few options. There's snap-in, snap-out dentures on like 2 or 4 implants. And then there's upper and lower teeth that don't come out. Do you do a lot of the snap-in dentures?
I would recommend that people do not do snap-in dentures on the upper. I don't do it.
Why?
I don't like them because the patients don't like them. And it requires a little bit more of, appointment time, adjustments. And then at the end of the day, you still have teeth that are coming.
Still a denture.
It's still coming out of your mouth. There's nothing natural about that. Who wants that? Who wants to have? You have to take those teeth out when you sleep. You know why?
Why?
Because you're going to risk getting a fungal infection underneath the denture if you don't.
Is that right?
Yeah, you have to take it out.
Oh, that's terrible.
If you sleep with those in.
Now I've interviewed dentists. They never told me that part.
Is that right?
Yeah.
Well, they don't want to go to sleep next to their significant other and have to take their teeth out. So a lot of times people will leave them in, even though they know that they're risking some type of infection to take place. And I get it, because it is embarrassing. I've had probably quite a few people that have come to me, and if they're dating, their significant other doesn't even know that they have teeth replaced. They don't know they have these upper teeth supported by implants.
Okay.
And so I always find that a little bit comical when they're hiding that, but it's understandable.
Yeah, because you don't have to tell them.
Yeah. Yeah, why would you?
And if you take care of them, could it last a lifetime?
It could last a lifetime. There's a lot of cases that when I'm putting the teeth in, I know that they're going to last a lifetime because of the way that it's engineered.
Okay, good.
The way that the teeth are made. I would be shocked if some of these people came to me in the next 20 years with any type of problems at all. We kind of dot our I's and cross our T's to make sure, because when I'm doing the procedure and I'm giving the person teeth, something in the back of my mind is, okay, I'm not always going to be here next to these teeth to maintain them while they're out, and so I have to make the teeth strong enough and engineer it properly so that they can go to Europe on a maybe like a 1-year trip or something along those lines without having to worry about something falling apart, and it's not going to fall apart.
Very nice.
Yeah.
Now we're short on time, probably 2 minutes left, and I know you want to show more photos, so I'll rush you a little bit. What are we looking at?
All right. So we have a gentleman here. He's got some teeth that are breaking down. He comes in 1 week. He's got his limited teeth, and then he comes in the next week, and even one more is missing. And so we tell him, hey, you could either go down that line of trying to fix each tooth individually, replace each tooth with an implant, or be a little bit more effective about this and just get it done. And so that's what we did. We got it done.
Let's take a look. Yeah. Very nice.
So he has upper and lower teeth that are fixed implants, and they do not.
Fixed mean they don't come out.
They don't come out.
Okay.
So take a look at this picture.
Okay.
Of me and this gentleman together. His smile looks better than mine. What do you think?
Yeah, I think so in this shot.
So yeah, that's the goal, and that's across the board. Here's another patient. She's in the before picture. She is smiling, but doesn't isn't showing any teeth because a lot of them are missing and things like that. The after picture, beautiful smile.
Big difference.
Yeah, and even when once again, take a look at that. Look at me and her smiling together. Whose smile looks better?
She's got you beat again.
She's got me beat.
Okay.
Yeah. All right.
Time for one more.
Here's another picture here. The profile photo shows his face is sinking in. He doesn't have upper teeth, doesn't have lower teeth. Everything's kind of sinking in on him.
Okay.
And so I see that, and I look at that in the consult room, and I think, okay, we can help you. We can give you some teeth that look a little bit better than that. And restore the it'll restore the structure of his face a bit there. And so once again, you're looking at my smile, you're looking at his smile. Whose smile looks better? That's my goal for all my patients. His is better. His has to be better. That's my standard. And this picture is of him eating an apple. And so, funny story about that apple that he was eating. He said that he was actually scared to take the first bite because when he had a denture, and most of the time he didn't even wear his denture, but when he did have a denture, when he took a bite of an apple, denture would come out. And so he was very timid to take that first bite of an apple. I think it was a couple weeks after the procedure before he even attempted. But when he did, he took one bite of it, and he kept going. He ate that whole apple, I think, in about a minute.
And then he sends you the photo.
And then he sent me the photo. And he wanted to talk to me about it at the next appointment, and I thought that was that stuck.
So that's when he showed you the photo.
Yeah. This gentleman came in. He was thinking that when as soon as he had his denture, he went to the restaurant, looked at the menu, started picking and choosing from the menu, and immediately he told himself, "All right, I'm not that guy. I cannot be that guy. That has to choose which foods I can and cannot eat." So he wanted something that he would be able to effectively, take a bite of some steak and eat every last bite. So
this is one of those guys that did not want a denture. That's why he goes to you.
Yeah, and he kind of realized that about himself as soon as he started experiencing the lifestyle change when he had one. And he came in and we gave him teeth that fixed implants, didn't come out, and he was able to eat anything he wanted to.
Looks good.
Yeah. This gentleman here, so take a look at that before picture.
Yeah.
Now, can you see the tilt on the left side? You see the teeth tilting because of the bacteria infection going on? Loose teeth, tilting. And so funny thing about him, he put this procedure off for years. And it was because he thought that it would cost so much money. But when he finally came in, and he finally got a quote for how much it would cost, he moved forward the next day. He said, wow, that's nothing like what I thought it would be. This is actually a rather affordable procedure.
Looks good.
Now on the after picture, I want you to also look at the left side. Now, do you see how the teeth were tilting before, not tilting after?
Now they're straight.
Now they're straight. And another thing that he really wanted is all of the teeth to be in the exact same spatial position as the before. So with the digital technology, we can do that. Now, I even picked out a little point on his mark on his lip, and relative to that mark on his lip, the teeth are in the exact same position. The midline's the same. The anatomy of the teeth is the same, maybe a little bit less broken down, but nevertheless, we got that just like he wanted it.
Okay.
Here's a patient that was in pain, couldn't eat the foods he liked, couldn't chew, and so he wanted implants that would help hold his teeth in place so he would be, able to live a more full lifestyle.
I got to bring this up. So I guess dental insurance, even the best dental insurance, doesn't really cover this, or maybe max payout of about $1,000, $2,000. Medicare, Medicaid doesn't cover it.
Yeah, but they're financing it.
Okay.
This is a procedure that is financed. Most of the time, it's not covered by medical insurance, and it's financed, and we have options.
So you guys help them out with that? You have to have okay credit, is that correct?
Yeah, the credit score has to be somewhere around 600 plus.
Okay.
But with that regard, they typically approve most everyone.
Did you tell me they could even get a cosigner?
Yeah, they can get a cosigner.
Okay.
Yeah, it's just like anything else.
Okay. Now, final message. We're out of time. Two groups. You got the denture wearers. They've heard what you have to say. Then you also have those patients that still have teeth, but they have the bleeding gums and the bad breath and loose teeth, and they're feeling like they're going to end up in a denture. They've heard what you have to say, but they're skeptical or afraid. What do you say to them?
I say just come in, find out what your options are.
Okay.
And I have models and things of that nature I can show you when you're sitting across from me, so you can actually see visually what this actually looks like. Now, it's not a long appointment. It's typically, there's not a fee involved or anything like that, because my main goal, like I said before, is to tell people what their options are. I want to take down the barrier and just have everyone understand, I could either go this direction or this direction. But as long as you know and you're making an informed decision, that's my only goal.
Correct me if I'm wrong. 3 steps to get this done. Yeah. Step 1, consultation, determine whether they're a candidate. Step 2, once they decide to move forward, the smile design. And then the third step, you get your new teeth. Is that correct? I don't want to oversimplify it.
Yeah, so I would even condense that to 2 steps, because what we do is when you come in to find out where you're going to get done, we take a digital record at the same time if you want to move forward with treatment. And then at your second appointment, we're actually doing the treatment. So you're leaving with
Very nice.
upper and lower teeth that don't come out at your second appointment. And it's all because we have the digital technology to do so.
You have like your own lab that prints the teeth right there.
Own lab that prints the teeth right there, and expert designer, and so it's a beautiful thing.
All right, I want to thank you for coming to the show. Good stuff.
Yes, sir. Thanks for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.